Mental Status Examination or MSE. Today we are going to discuss the component speech. During a MSE, listen to the patient speak in order to assess for a potential speech disorder. Listen to the rate of the speech, volume, quantity, fluency and tonality. The causes of the abnormal speech can be due to a psychiatric disorder like mood disorder, anxiety or schizophrenia, confusion in the disorders like delirium, dementia or intellectual disability, then dysphasia, dysarthria. Dysarthria happens because of stroke, brain injury or maybe in Parkinson's disease. Then dysphonia, that is due to the problems in laryngitis, neuropathology, trauma, atrophy or systemic disease. Then hearing impairment, then English as a non-native language, intoxication. All these can be the causes of abnormal speech. Terms used. The latencies. The time between you asking a question and the patient replying. The volume. Both how loudly one speaks and the number of words one uses. Rate of speech. That is how fast one gets the words out. Then the rhythm, regularity of phrasing within sentences. Then intonation, the amount of inflection or cadence in the voice. Rate of speech. Slow speech. It can be due to psychomotor retardation. Then normal speech rate. Then rapid speech. It is the fast speech but able to be redirected. That can be due to psychomotor agitation. Then pressured speech. The speech will be fast and without taking breaks, talking over other people and unable to be redirected. It can be seen in patients with mania or anxiety. Volume of speech. Loud. It may be associated with psychomotor agitation. Normal speech. Then weak. It may represent the shyness. It is considered normal. Then low self-esteem. That can be seen in patients with depression. And then dysarthria. Dysarthria occurs when the muscle you use for speech are weak or you have difficulty controlling them. Nervous system disorder and conditions that cause facial paralysis or tongue or throat muscle weakness or certain medication also can cause dysarthria. So, in the volume of speech, we are looking whether the patient is whispering or speaking inappropriately loudly. Quantity of the speech. Expansive. Here, the speaking at length and apparently without end. That is, they speak continuously and it can be seen in patients with mania or anxiety. Then, talkative. Those patients actively take parts in the conversation. It is considered normal. Then, poverty of speech. In such patients, the speech will be very little even with persuasion. It can be due to shyness or psychomotor depression. Fluency. Listen for the speed, the intonation, phrasing and expression of speech. Normally, people comfortably speak at a rate of 100 words per minute. Less than 50 words per minute is indicative of disfluency. The causes of this can be dysphasia, dysarthria, confusion like in delirium, dementia or intellectual disability, then hearing impairment and language problem. The patient may be a non-native speaker of English and then intoxication can be the causes of impaired speech fluency. Tonality. Resonant. The tone will be rich and deep. that is loud and clear. Monotone. The patient uses single tone for vocal expression. It can be due to boredom or any psychomotor retardation. Latency of speech. Respond spontaneously. Check whether the patient is responding spontaneously to the question you are asking. Or is there any long pause in responding? Are there any long pause between the question asked and the patient response? If the patient is mute. A small number of patients are mute during the interview. If so, note down apparent level of comprehension. That is, does the patient appear to understand what is said? Example, like if the patient is shaking the head or nodding the head appropriately to the question asked. Then level of alternate communication. Can they write answers down or do they point or use gestures instead of speaking? Then level of structural impairment. The level of structural impairment of the organs of speech, that is, there any evidence of dysarthria. When assessing speech, consider the presence of word finding difficulty, then echolalia and signs of aphasia. Then are there any of the words are made up? That is, neologism is there or not? Need to check that. So this is all about assessing the speech during a mental status examination. Hope you like this video. Content of the speech is explained in third component of the MSc. So subscribe the channel to see more of MSc components. Thank you and keep smiling.